My name is Kwabena Chenche Heneboati. Many thanks for joining us here on NewsDesk. To our very first story, and the Mental Health Authority intends to conduct a national census for mental health patients across the country. According to the Chief Executive of the authority, the move is to enable the authority collate data on the accurate number of mentally ill patients across the country in order to effectively deal with the situation. But the question on the minds of many, including myself, is how the authority plans on doing this. But let's first take a listen to Chief Psychiatrist and Chief Executive Officer of the Mental Health Authority, Dr. Akwesi Osei.
If relatives appreciate that, yes, this was our own kith and kin, he was ill, he is now well, and let's embrace him, let's show him love, let's give him all the support, they will remain well. But sometimes the fear of the stigma, that is what prevents us from showing the love and giving our due responsibility to them. And that is where it's very crucial we need to work on.
How many of these ill people have we been successfully been able to integrate into the society?
Since we started about 70. 70, yes. We are going to do a national census of mentally ill throughout the world, throughout the country, in the next 1 or 2 months.
We have a way of identifying if we have an increasing number of them on our streets.
Empirically, the numbers are increasing, but the numbers may be increasing. Let me say that
we are seeing an increasing figure.
Increasing numbers. Yes, we are seeing increasing numbers. However, that does not necessarily mean that absolutely they are increasing, because if population is increasing, if they were 500 some time back, when population was, let's say, 20 million and it's now 27 million, we expect the numbers to increase. So that one, the numbers are increasing. But it's equally possible that the stresses of life, our inability to attend to our relatives, may also be increasing the real numbers. That's also true. And that is why we want to do the census now, and then every now and then, let's say every 5 years or so, we can also be repeating to see the increases. So that one is very important. So just as we are doing national census, population census for everybody, we also want to do for the mentally ill. I don't know whether in the national population census, those for the streets are counted, but now we are going to capture them, so we know the numbers.
When are you going to do others?
In fact, we intended it to be this in May, but it looks like we may not be ready by May, but latest June, it will be done.
So some interesting comments there, and I'm just wondering how they plan on doing this really. But let's try and have a conversation on this very issue. And joining me in studio now to help us do that is the Deputy Director for Community Care at the Mental Health Authority, Priscilla Elikpulim-Teria, and the Executive Secretary for the Mental Health Society of Ghana, Humphrey Kofi. Ladies and gentlemen, many thanks for joining us here on NewsDesk. So let me first find out from you, Priscilla Teria, how do you, for instance, plan on identifying people who are mentally challenged?
Thank you very much. Actually, society also recognize these people with mental disorder in our life, in our day-to-day activity. If you see somebody who is not mentally well, you can easily recognize that one. So,
so if you see me and I come to the office every day, I do all the things I need to do, it suggests I'm okay, and someone probably naked walking down the road or partially naked walking down the road might be mentally challenged?
When we want to talk about mental health, mental disorder, like people who are suffering from mental disorder, it's not only those who are roaming on the street that are having mental disorder. You can dress well, be in your office, but the way you talk, your behavior can indicate.
Exactly my point. So how then do you know that's mentally challenged or not?
Through your behavior and your speech. Basically, your behavior and your speech will identify. We'll use that to identify whether you are mentally ill or not. But currently, what we are doing is that we want to count those who are having mental disorder and they are neglected in our society, and they are walking on the street. They are roaming about. Those are the people we want to identify, count them, and they know the disease burden in the country. They will plan towards removing them and managing them.
I'm still a bit confused. I'm still struggling to understand how you're, first and foremost, find it difficult to identify these people, and then the capacity to go around the country and do a count of all these people.
It is not difficult at all to identify those who are mentally ill roaming on our street. like I said earlier on, their behavior.
So your focus has to do with those on the streets?
Those on the streets.
How about those in the homes?
Those in the homes, they are in the homes. That's one, we encourage the relatives to bring them to clinic for treatment. But currently, we are focusing on those on the street. We want to identify them and know the disease burden and then plan towards managing them. You know, it's their basic human right. They have the right to health. It's mental disorder that is worrying them, not anything. So if we can identify them and then treat them, they can contribute their quota to society.
Okay, I'll be coming to the capacity to actually pull off this very plan you have. I think it's a brilliant idea anyway. I'm just looking at how you're going to go about this whole thing. But let me bring in now Humphrey Kofi, who is with the Mental Health Society. He's also here in the studio with us. So, Mr. Kofi, I mean, you've dealt with persons with challenges, mental challenges and all. I mean, what do you make of this move by the Mental Health Authority?
Yeah, of course. Thank you so much. That is a giant step to take, because if you want to address a problem, you need to know the burden. You need to know the size of the issue you are talking about. If you talk about vagrants, people who are stripped naked outside, you can see them. It's obvious that they sleep under the bridges, uncompleted buildings. Those are obvious.
Could it be that they are just probably homeless?
No, it's because their family have rejected them. Nobody wants to associate with any vagrant because of the fact that there is so much stigma attached to it. Even if he stood in front of the Accra Psychiatric Hospital this morning, I'm sure you have colleagues who will call other colleagues and find out, it's like, I saw your friend in front of the psychiatric, anything wrong? So that is telling you the burden of the stigma, and that is why families are not ready to associate with vagrants. So it's okay for the authority to have the statistics, and so that they will be able to address the issues. Because if you look at section 73 of the Authority Act 846, it talks basically about these vagrants being taken away from the streets by the police, by the district assembly. Now, where do you take them to? You take them to the institutions because they are aggressive for them to be treated. But if you don't know the disease burden, if you don't know the data that you're dealing with, how do you provide medication? How do you provide for all these people? So these are things that comes within the body of the statistics, and I think that it's in the right direction. However, it's not only people who are stripped naked who are mentally ill. In fact, the chief executive of the authority once said that if he's given the power to take out people with mental disorders, you start from the offices. Like Priscilla rightly said, appearance, speeches, incoherency in the way people speak, the way they behave, the way they dress. If you begin to speak to somebody within your office, how does he respond? In fact, somebody has said it, and jokingly, that, if that is the case, then most of us who sometimes hold our keys and looking for them are kind of suffering from mental disorders. But that's not the case. That's just by the way. It depends on the consistency of that same character or behavior. So we're definitely talking about people on the streets that we can obviously identify for this purpose.
Let's look at timeliness and prioritization. Would this be the best step by the authority at this particular point in time, you think?
Yes, there is nothing late. I mean, once it started, because once the mental health law has come into place, it's talking about the rights of people with mental disorders. If you look at section 54, if you look at section 55, it talks about discrimination, talks about the basic human rights of people with mental disorders. They all have rights which are inalienable, just like any of us. And we need to protect that. It is within the United Nations Declaration that once we have ratified all these things and we are signatories to we should ensure that even people with mental disorders enjoy the same rights just like any other person.
Okay, so back to you, President Lataria, and I'm really very keen on this very subject. And first, let me find out, when do you plan on rolling this plan out?
We propose next week, 11th May.
Next week?
Yes, 11th May. 2016, 6 a.m. to 4 p.m.
And it's going to run for how long?
6 a.m. to 4 p.m.
Is it just
11th
one
May,
day?
just one day.
And you're going to do this nationwide?
Nationwide.
Is it not a bit of doing a census in one day and national census?
Yeah, we are doing it one day, same time, same day, because we don't have control over the movement of our clients. They roam. So when you want to do it region by region, you finish with region A. By the time you go to region B, maybe you finish with Brong-Ahafo. By the time you get to Ashanti, some might have moved from Brong-Ahafo to Ashanti. So there will be double counting. That's why we want to do it the same day,
at the same time, the same day. Okay, so in doing this collation, so should you go to a community and someone should point to, say, Kwabena Chencheneboating who lives in this house, we think he's mentally challenged, he's been behaving quite funny of late. So what is going to happen? Will you come there and count me as one of those people?
If the person is in the house,
yes,
the person will not be counted. But if the person roams on the street,
okay. So maybe at the time when that very information was given to you, I was out on the streets, probably getting something.
Well, basically, I told you earlier on that you have to engage the people in conversation.
So you engage me.
You engage.
What will you ask me?
How are you?
I'm very
What's
fine.
your name?
My name is Kwabena.
Through that, I will detect whether you are mentally.
But you say that you are relying on the information that's going to be given to you by these persons who live with these mentally challenged persons in the community.
Absolutely.
So if they are saying that I'm mentally challenged and you come to me and you speak to me and everything seems fine, what happens?
Yes, the fact is that you don't use one tool to assess the mental state of a person. So community members, for instance, right now, you have colleagues that you work with. They know your behavior. They know the way you talk, the way you dress, the way you behave. So if there is a change in your behavior, they can recognize that easily and maybe inform you to call for help, or they will support you to call for help.
I understand. Yes. I understand what you're saying. So I'm saying, so my colleagues at work or my community members say they think there's something wrong with me mentally.
Yeah.
And I just want to find out how this census thing is going to work. So you come to me and then you try and do your own assessment, and you're not convinced that there's anything wrong with me. What happens? Is it their word over what you've seen, or your own assessment over what?
Well, we have our colleagues all over the country. They will continue to assess you to see whether...
For how long? Because this is just a day's exercise.
Yeah.
So for how long are they going to waste so much time on just one person just to see whether or not he or she's mentally challenged?
Absolutely. I told you earlier on that the community will also support us, and the personnel, the mental health personnel, will also support in the counting. So definitely, maybe like you said, that maybe you are in the house, you just walk out to get something, and we meet you on the street, and they will start counting you. We'll verify, definitely.
How
community is the community is very helpful. Somebody somehow will just tell you that, oh, this person lives in this house. It's not a vagrant, So we are relying on the community.
I'm still not convinced, but Humphrey, are you convinced?
Yeah,
you think this approach is going to work?
I'm just going to add to what Priscilla is saying, that if you look at the districts that we have across the country, we have facilities that manage people with mental health conditions within that setting. There are records, clinical records of people within that community that have been reporting for review and diagnosis. So there is that record already there. Now, these records are definitely going to be verified, because somebody could, out of malice, just pinpoint somebody and say that this person I know sometimes talks rubbish, excuse me to say so, then I can impute mental health condition. But there should be a historical record, clinical record that shows that he's been attending the facility.
So if there's no record, I'm not going to be counted?
No, you can't immediately be counted by the fact that somebody is saying this. You have to be diagnosed, first of all, because nobody can just pinpoint by way of the person's
But that's the
ordinary,
very thing we are hearing from the Mental Health Authority, that they're going to act based on the information given them by the society, and consider other things as well to verify.
In addition to that, we have community-based volunteers in health. They are reliable people that we are going to consult, and they are going to help us do the exercise.
Okay.
After counting, we will now do further assessment. And then after counting, the figure will not be what we've got. We will do further assessment to...
Okay, and what will this further assessment entail?
Assessment of the client, further assessment of the client.
What will it entail? As in, what will you do to further verify?
Physical assessment, mental assessment, psychological mental assessment, to ascertain that truly this person is, we are all from a community. Have you met any vagrant in your community before? Any vagrant in a community is easily identified.
But what I think may be the case may not exactly be the case.
Yes. So all that we need is that. After that, we'll do further assessment.
Okay, I'm still not too convinced anyway. But
Yeah, I believe that what Priscilla is trying to Peter is basically to do a further investigation.
I understand that, but I just want to know which form that further investigation is going to
You
take.
see, it's not all vagrants who are mentally ill.
Yes, my point.
Yeah, all vagrants. Not all vagrants are mentally ill. So that's why we are relying on it. If somebody is behaving strange, bizarre, you can easily identify that.
Okay. So
after identifying, we will do further assessment. We'll take the person to the facility, assess the person mentally, physically, psychosocially, then identify whether and confirm whether truly the person is mentally ill or not.
So by that time, I would have been counted and I would have been taken to the home for further assessment, right?
Yes.
Okay. Now you speak of what if we go in there and you do your further tests, and that proves that indeed I am not really mentally challenged, like you were suggesting. You speak of wrong taggings and people tagging you wrongly, the stigma attached to this very thing. So what happens then? I was fit, I was okay. You took me in there, now I come back and society sees me in a different light.
Now assessment could be done at any hospital throughout the country. There is no need to take you to Accra Psychiatric Hospital, Pantine or Ankafo before assessment will be done.
But the fact remains that I would have been counted as a mentally challenged person who needs treatment, and then I would have been taken to the hospital.
You know, when we define health by World Health Organization, health is a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. So the person might have been suffering from something. Why is he outside? Why is he a vagrant? That socially the person might be sick. So what we are going, the data though, not mentally sick, but might be socially sick. Why are you a vagrant? So after further assessment, they will refer the person to appropriate, department or facility for management.
Interesting. Okay, so let's now look at your numbers. The numbers you have to roll out this very plan of yours. How many people, for instance, do you have on the ground?
Currently in the community, we have about 965 mental health personnel.
So you have less than 1,000 people to embark on a nationwide exercise.
Yes, that's why we are relying on the community-based volunteers in health. They are reliable, and then the community.
So you have less than 1,000 people to do a census of close to should I say 1 million or 2 million people?
Yes. Some communities there are no vagrants. In some communities. So, my colleagues are on the ground. They know the community. We have district focal person in mental health. They know the sub-district. They know the chief's compound. They know the community. They know the people they are working with. They know the number of vagrants. They know the people who are roaming on the street and who are not roaming on the street.
So you'll be deploying these 960 persons you speak of, district by district or region by region?
District by district. Then sub-district by sub-district. Yeah.
So for every district, let's say we'll have 2 persons or 1 person?
Yeah. Okay,
so what would typically be their job?
The mental health work is a teamwork and it's collaborative work. Okay, so you may have a mental health personnel, maybe 2 or 1 in that district, but other health workers who support. Community health workers are there, community mental health workers, like I said, the community-based volunteers. Community health workers, they move into communities and they know all the communities. So we are relying on the
exactly
team.
What is going to happen on the day. For instance, so that when I wake up in the morning and I see some people in front of my building, I don't get so scared or think something is happening. So typically, what is to happen on the 11th of May?
Okay, on the 11th of May. Prior to that, everybody will know, we'll assign ourselves to the sub-district, district, and the chief zone, whatever the communities, number of communities that you'll be responsible to. Then on that day, when you wake up, all that you have to do is to call your colleagues, the community-based volunteers, to call them, whether there is any vagrant in their community. And then sometimes you go to verify, other times you rely on them.
Well, why do I get the feeling this might not be as effective as we hope it to be, or we expect it to be, because of how the rollout is being couched?
Yeah. It might not be effective as we wished it to be due to a lot of factors. You know, ideally, if we want to do this very effectively, we need support, financial support, so that we can deploy people on the ground.
I'll be coming to the financial support bits in just
but currently, we are just using it as part of our routine activities, and other team members will support us.
I'll take that as I take your concluding remarks as well. But let me come to Humphrey Kofi. Humphrey, do you think there's a better way to handle this whole thing? Essentially, I mean, there have been a number of issues raised with how the country itself has managed persons with mental issues. Really, is there a better approach?
Well, for this particular rollout, this is my first time that I'm getting the details of it, and I don't seem to have a better understanding of how it's supposed to be done. But I want to believe that the agenda or the rationale is very good. We would also, as a civil society, monitor how it goes. And
so that means you haven't even been contacted in any way?
Not really. It's only that we've heard about it, but not being formally told about. And so that we don't have the details. But be it as it may, as it's rolling out, we want to believe that the rationale is also good. The modus operandi is what we're going to monitor and see how effective it becomes. And if there are suggestions, as a civil society would rather lay it before the authority as well.
Okay. So while you conclude, Ms. Teria, I just want to find out again. You said you're going to roll this out. You need funding, you need support. I know over the past few months and years, we've heard the mental health authority speak of not enough drugs, not enough money, not enough resources. So how do you plan on getting all these things? Or is just a means to solicit for more funds?
Absolutely, that's one point. And another point is to identify the disease burden. We always complain that vagrants are increasing on our street. What is the evidence? It could be that same person that you have seen walking over.
So you just want to have a database
on the vagrants on the street. Then we plan towards them. You know, now management of mental disorder is not only medical, it's biopsychosocial. You know, we need a social aspect. You need to rehabilitate them. You need the family to be involved. You need the society to be involved. And as lower middle income country, you know, it will not speak well of us if our own are on the street. So I think when we identify the burden, then we'll plan towards it and see how best we can treat our own so that they move out of the street into
Many thanks for your time then on NewsDesk this morning. But again, I just want to be clear. So on May 11, from 8 a.m., did you say, to 5 p.m.?
Yes, 6 a.m.
to 5 p.m.
6 a.m. to 4 p.m.
To 4 p.m.
You know, early in the morning, most of them, they go look for food. And so you can start counting them. And the people who are doing the counting are people living in the community. My colleagues are on the ground. They are living in the community. So it's like if you know somebody who is vagrant in your community, you have identified the person.
Many thanks for your time on NewsDesk. Priscilla Teria is the Deputy Director for Community Care at the Mental Health Authority. She is joining us in studio, and she's been helping us understand really what it is the authority plans on doing as far as getting a database of mentally challenged persons in the country is concerned. Also, Humphrey Kofi, who is with the Mental Health Society, also joined us in studio with a lot more perspective also on the mental situation in the country as it pertains, and this very action by the Mental Health Authority. We'll be keeping an eye on this, we'll be monitoring this, because you're saying that on Monday, May 11, Wednesday, on Wednesday, May 11, they will be embarking on this very exercise to get that very database. We'll keep an eye on this and bring you a lot more subsequently. But let's take a break here on NewsDesk. We'll be back shortly with a lot more stories. Don't go away.